Benign prostatic hyperplasia is a condition of an enlarged prostate that is associated with various symptoms like increased urinary frequency and urinary urgency. However, people may have a weak stream of urine due to the blocking of the urethral pathway. This BPH can be treated by many of the drugs, including a well-popular medication, Tamsulosin. Tamsulosin increases the urinary flow, thereby relieves the symptoms of BPH. However, it is not decreasing the size of the prostate gland. Another medication is Dutasteride, which is a hormonal analog that can be used to reduce the size and improve the symptoms of BPH. Now, both of these drugs can be combined in a single capsule, and they can be used for the treatment of BPH, which has an added advantage. However, along with increasing their benefits, they may also have mixing up of their side effects. This video covers the important information about the Tamsulosin and Dutasteride combination. How does this combination work in improving the symptoms of BPH? What are the important precautions that should be considered? What are the side effects of this combination? How to take these capsules? What are the doses? All such things we will discuss in this video. First of all, let us see how this combination works. Tamsulosin is the alpha-1A adrenergic blocker. These alpha-1A receptors are located on the smooth muscle of the prostate, bladder neck, and urethra. Normally, these receptors are responsible for the contraction of the smooth muscle. Tamsulosin acts as a selective alpha-1A receptor antagonist. By blocking these receptors, it produces the relaxation of smooth muscles in the prostate and urethra, which increases the urinary flow. It also relaxes the bladder neck, which reduces the pressure on the bladder. Thereby, it reduces the urinary frequency. However, Tamsulosin is not having any effect on the size of the prostate gland. It only affects the relaxation of the smooth muscle. The reduction of prostate size can be achieved by Dutasteride. Dutasteride is a 5-alpha reductase inhibitor. It inhibits both type 1 as well as type 2 enzymes. Actually, the 5-alpha reductase enzyme is responsible for the conversion of testosterone into dihydrotestosterone. This dihydrotestosterone plays a key role in the growth as well as enlargement of the prostate. Dutasteride blocks this enzyme, thereby reducing the levels of DHT in the body. When the DHT levels are reduced, it reduces the prostate size and prostate growth. In this way, Dutasteride helps in controlling the enlargement of the prostate. Therefore, this combination can both increase the urinary flow and reduce the further growth of the prostate. Thereby, it can improve the symptoms of BPH. Now let us see how to take this medication. Dutasteride and Tamsulosin combination is available as a single capsule. In each capsule, Dutasteride is available at a strength of 0.5 milligrams and Tamsulosin at a strength of 0.4 milligrams. In other words, Dutasteride is 500 micrograms and Tamsulosin is 400 micrograms. For treating benign prostatic hyperplasia, one capsule should be taken every day. From this capsule, Dutasteride shows more absorption compared to Tamsulosin. Around 60% of the Dutasteride is bioavailable, whereas only 10% of Tamsulosin enters into the blood. However, Tamsulosin shows its action immediately within 4 to 8 hours, whereas Dutasteride takes more time because it is going to reduce the size of the prostate gland by reducing the levels of DHT. This may take more time, and it can show its actions after 1 to 2 weeks of treatment. These capsules should be swallowed whole. They should not be crushed, chewed, or opened. You should store these capsules at normal temperatures. Storing at high temperatures may cause deformation or discoloration of the capsules. In such conditions, you should not use such deformed capsules. In case of a missed dose, you can take this capsule at any time of the day. However, never take 2 capsules in the same day. While handling these capsules, you should take care because Dutasteride can be absorbed through the skin. Therefore, women who are pregnant or could become pregnant should handle these capsules very carefully. Now let's see the precautions of this medication. Tamsulosin can produce orthostatic hypotension. It may result in dizziness, lightheadedness, and vertigo-like symptoms. It may also increase the risk of syncope. Therefore, you may have a risk of falls and unconsciousness. These effects are more pronounced during the first few weeks of the therapy. So be careful while standing and rise very slowly to avoid any risk of falls. A few of the urological conditions may also produce similar symptoms like BPH. Therefore, before starting the therapy, any other coexisting factors should be checked. For instance, in people with prostate cancer, similar symptoms like BPH can be observed. So, proper examination should be done to rule out the presence of prostate cancer. When the capsules are handled by women, particularly those who are pregnant or may be pregnant, caution should be taken. One of the components in this combination may be absorbed through the skin. Dutasteride can easily permeate through the skin, and it may result in fetal exposure. This may increase the potential risk to the male fetus due to its effect on the prostate gland. Therefore, these captures should not be handled by pregnant women or women liable to be pregnant in a few months. In case of any accidental contact with the contents of a leaking capsule, the contact area should be thoroughly washed immediately with soap and water. Tamsulosin can produce a condition of prolonged erection. This is called priapism, which is a painful and persistent erection. However, this is a very rare condition that may be observed with alpha-1A blockers. This may result in the development of impotence if it is not properly treated. Whenever you observe a prolonged erection, immediately, you may discontinue this medication. This combination contains dutasteride, which may affect pregnant women. Therefore, you should not donate the blood until at least 6 months after the last dose you have used. Because this dutasteride can enter into the blood, it can be transferred to the recipient. If the blood recipient is a pregnant woman, it may produce a harmful effect on the male fetus. Therefore, you should not participate in the donation of blood for at least 6 months after the last dose. In a few people, tamsulosin may produce allergic reactions, particularly those who are allergic to the sulfa medications. It may result in itching, skin rashes, and swelling. In case of any such serious hypersensitive reactions, use of tamsulosin should be avoided. Among these two medications in the combination, dutasteride may have a risk for developing prostate cancer. This is common with 5-alpha reductase inhibitors. Normally, dutasteride can reduce the serum PSA levels. When this dutasteride is combined with tamsulosin, the decrease in the serum PSA levels is more pronounced compared with monotherapy. This may indicate the presence of prostate cancer. Therefore, your doctor may check your PSA levels regularly, and a new baseline of PSA levels should be established for at least 3 months after starting therapy. Recording any lower PSA value than this baseline may indicate the presence of prostate cancer. If you are undergoing any surgery for cataracts or glaucoma, you should avoid this combination temporarily. Tamsulosin may cause a condition called intraoperative floppy iris syndrome. Since tamsulosin is an alpha-1A blocker, it can produce a flaccid iris and pupillary constriction. Since this combination contains tamsulosin, these capsules should not be taken before the eye surgery. PDE5 inhibitors like sildenafil or alpha blockers like doxazosin and terazosin may increase the risk of hypotension when they are combined with these capsules. This is because the hypotensive effect produced by tamsulosin may be increased by these drugs. Both tamsulosin and dutasteride are metabolized by the CYP3A4 enzyme. Strong CYP3A4 inhibitors like ketoconazole should be avoided because they may interact with the metabolism of both tamsulosin and dutasteride. Similarly, CYP2D6 inhibitors like paroxetine can increase the levels of tamsulosin. Therefore, it should be used with caution. What are the side effects of these capsules? Due to the long term of therapy, this combination can produce a few of the long-term side effects. Importantly, this combination can produce dizziness and hypotension. Other side effects are mainly related to the erectile tissue. It can produce ejaculation disorders like prolonged erection, impotence, and loss of libido. Testicular pain and swelling can be observed. It can also produce a few of the breast disorders. You may have hypersensitive reactions like rashes, itching, and swelling. Dry mouth, blurred vision, and constipation can also be observed. Most of these side effects are more pronounced after at least 1 year of use of this combination. So that's all about this medication, tamsulosin and dutasteride. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.